everyone, welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. It is my immense pleasure to introduce Dr. Krishnamani, an esteemed and expertised medical professional in medical oncology, who has more than 10 years of experience. Doctor, Doctor, with without any further delay, I will let's extend a warm welcome to Dr. Krishnamani and request Dr. Krishnamani to give some opening insights to this cervical cancer management session, Doctor.
Good afternoon. Hello, everyone, and welcome to Cancer Reach, which is an initiative from our end to spread awareness about cancer. We had the last time around discussed on cancer prevention for cervical cancer because that week was about cervical cancer prevention. So we also thought that since we are covering about cervical cancer prevention and screening, why not cover cervical cancer in a bit of detail on how commonly patients present and how we are going to diagnose them and treat them. So this session today, half an hour, 40 minutes is going to be on that. And the whole thing is going to be on how we are going to diagnose and treat this deadly disease.
Thank you, Doctor. As Doctor, you have mentioned, it is a deadly disease. So I hope this session will be full of compassionate and patient-centric oriented approach for cancer management. So without any further delay, let's start the session. Doctor, what are the warning signs and symptoms for cervical cancer?
So before going into that, what I would just like to emphasize is why I mean deadly is, see, it's an extremely common cancer. It's the second most common cancer in women in India, and in some places it's the number one also. We discussed last time around. We see it in a lot in the rural population, and also now because of a lot of migration, we do see it in the urban population too. It's a cancer which is actually preventable. Vaccine exists, screening protocols are there. Women should get screened. We have discussed that with pap smear last time. Despite that, in India at least, most cancers present in an advanced stage. That's why it is deadly. So that is the initial part. Now coming to how does it present out? So by the time the patient has symptoms, the disease has usually progressed. And one of the most common symptoms is vaginal bleeding and or a vaginal discharge. Some women can be asymptomatic, that is, have no symptoms. They are detected on screening, like a PAP or HPV testing. But those who present with symptoms present with either bleeding or discharge. Sometimes the bleeding can be after a sexual intercourse, which is called postcoital bleeding. So women who have postcoital bleeding or abnormal vaginal bleeding, uh, think about cervical cancer and consult your doctor and get yourself evaluated so that you either rule in or rule out this cancer. If it is even more advanced, then women may present with pelvic pain or pain abdomen, chronic pelvic pain, which is not improving. That happens when the disease goes out through the cervix into the nearby structures, and then you can have a chronic pelvic pain. And very, very rarely, if it spreads to major organs, so it can spread to the lungs. Patients can present with breathing difficulty, cough. It can present to the liver. They can present with pain or jaundice. It can go to the bones. They can present with severe back pain. So in that case, you will be evaluated for back pain. Then scans will be done. You'll be told that something is there in the bone, and then they will evaluate from where it has started, and then they may pick up something in the cervix. Usually, by then, the patient has symptoms in the form of vaginal bleeding, etc. So, bleeding is a commonest symptom. A lot of people do not have symptoms also if they are very, very early stage. 2. 3. Abnormal vaginal discharge and postcoital bleeding. 4 is symptoms due to organ spread. So this is the way we should understand how our patients are going to come with cervical cancer.
So, doctor, as you said that apart from bleeding, there is some kind of a discharge which can also be a sign or symptom for a cervical cancer. So, is there any color to identify, or is there any specific kind of a discharge which we can correlate
Not
to
really. See, these are all, it is not a very specific thing, a watery discharge or a brownish discharge. And discharge doesn't mean only cervical cancer. It can happen due to a lot of things. It can happen due to a lot of infections. Okay,
Yes.
so discharge doesn't mean someone has cervical cancer, and no specific color is specific for cervical cancer. But abnormal watery discharge or abnormal bleeding or postcoital bleeding should raise the suspicion. And if these symptoms are not relieving over a period of time, go and show to your doctor. Get yourself evaluated. That's the simplest thing to do.
Actually, generally, doctor, this kind of a situation are people get confused where to go. Go to gynecologist or go to cancer specialist.
Not really.
This.
Go to your gynecologist, get yourself tested. They'll examine the area. They will
Hmm.
do something called a per speculum examination. They'll examine the vagina, the cervix, and those areas. If something is suspicious, they'll ask you to get a pap or they'll do a biopsy. So
Hmm.
that's the next step. So for a first, meet a doctor. Not everybody has a luxury of an oncologist. So meet a gynecologist. Even an MBBS doctor. Okay, if you're in a remote place, people who are hearing us, if somebody is in a very, very remote place, you don't have a gynecologist. Now, most taluks also have gynecologists, but
Hmm.
even if show to a doctor, that is the first thing. Rather than hiding the symptom behind closed doors, go show yourself, check, have a checkup. Nothing excellent. If something is wrong, they will themselves suggest whom to meet next.
Yes. That's a great information, doctor. Then, doctor, what are the diagnosis tests available for cervical cancer, sir?
See, for all cancers, we have tests. Cervical cancer is one disease where clinical examination is the biggest test. So, the staging for cervical cancer is actually based on clinical staging, which is called examination. So, we do a local examination,
Hmm.
okay? Examine the vagina, the private area, the cervix, uh,
Hmm.
physically, and that's called a physical examination. And through the physical examination, one, we are able to diagnose the disease, whether there is a growth or an ulcer or not, whether it is bleeding on touch or not, and what is the local extent, how much is it hard, is it soft, is it bleeding, is it ulcerated, is it a cauliflower like growth, and whether it has spread to the nearby areas. So clinical staging is the most important thing. Nothing substitutes a clinical staging. Unlike, for example, a stomach cancer, you will say you will do an endoscopy and then do a CT scan. Endoscopy is to see the cancer and do a biopsy. CT scan is to see the spread. In this disease, physical examination is the most important thing. In fact, it's the cornerstone of staging. But now, apart from that, we add additional tests like a bone scan to see if it has spread to the bones, a CT scan or a PET scan to see the lymph nodes and spread to other organs. But those are next step. It is not the first step. So the minute you see a cervical cancer patient, you are not going to write a PET CT scan. Physically examine, look at the growth, identify the pattern of spread locally, whether it is bleeding on touch or not.
Hmm.
We write something called a clinical stage, and then we do additional imaging in the form of PET CT or CT or bone scan, etc., to see if it has spread to lymph nodes and other distant organs.
Sir, sorry to interrupt, but this clinical stage which you are referring that can be done by a normal gynecologist and MBBS for
Yes.
initially to
MBBS ideally should be done. We all are taught during our MBBS days. But
okay.
cervical cancer staging may be difficult for them, an accurate staging. So, a good gynecologist or a good oncologist
Hmm.
uh, should be able to do it. Will do it, obviously.
Okay. Doctor, what are the stages for cervical cancer?
So, broadly, it is like whether the disease is in the cervix,
Hmm.
whether it has spread just outside the cervix, or whether it has gone to different organs. If it is in the cervix, it is less than 4 centimeters, we use the term, then it is probably stage 1. If it goes down to the vagina, parametrial area, it is like stage 2. If
Hmm.
it goes to the pelvic side wall, those areas, it's like stage 3. And if it is, the disease has gone even beyond and touching your bladder and rectum, which is the large intestine's lower part, then it becomes stage 4 and goes beyond, it is stage 4 again, 4A and 4B, we say. So basically, disease is localized to cervix, just outside cervix, pelvis, and distant organs. So the best thing is to identify this disease early at the very, very earliest stage. And this disease is one which we discussed last time also, which presents in a pre-cancerous stage, like your oral cancer.
Mhm.
Oral cancer has, before cancer, you can sometimes identify called white patches called leukoplakia or red patches called erythroplakia.
Mhm.
That will turn into cancer, not in everybody. So you can take precautions to prevent it from turning into cancer.
Okay.
This one also has pre-cancer that is called SIN. Okay, CIN it is called. Cervical intraepithelial neoplasia, SIN 1, SIN 2. So basically, it is pre-cancerous. It is steps away from cancer. If you identify there itself through pap smear and etc., HPV testing, progression to cancer can be prevented. If you are having cancer, then you are either stage 1, 2, 3, and 4. 1 is extremely early. 2 and 3, we call it local disease or locally advanced. 4 is advanced disease.
So, doctor, like right now you told about the SIMS. So, in that, even if you regularly go and do the checkup around the gynecologist, they will highlight us that, okay, you
They
are
will only
having,
highlight. They will
okay,
only highlight. This again we discussed last time around. So
okay.
SIN is one term. Then the pathological term is high grade squamous into L cell, H cell. We call that. So what you are trying to do is you are seeing cell abnormality,
Hmm.
and you are saying this cell looks different. It is not yet cancer, but it is steps away from cancer. So here itself, you try to take precautions in the form of regular screening
Hmm.
or uh, colposcopic directed biopsy or colpectomy, or some people even go beyond and many times get a hysterectomy done also, which is not advised to. So what I'm basically trying to tell you is these are stages before cancer where you are going to take precautions.
Doctor, there is a query from a audience telling at what age should women start getting screened?
We discussed last time around. If you look at our last week's video, we have addressed this.
Yes.
So women above the ages of 21 will get a pap smear done every 3 years. If you are doing a pap plus HPV testing, you will get it done every 5 years. That's the dictum. And pap smear is available in all places.
In fact, in the last video, it has been clearly discussed about it. So I hope
Yes.
the more knowledge she will get from the last video, doctor, in detailed. Doctor, there is one more query. I know, I guess this can be also a repetition, but are there any lifestyle factors that contributes to the risk of developing cervical cancer?
Smoking and oral contraceptive pills is what we said, number one. Number two, more importantly, what did we discuss last time around? This is a disease which spreads through sexual activity. So anybody with high risk sexual behavior, early onset of sexual activity, multiple sexual partners, history of having sexually transmitted diseases, use of OCPs and chronic smokers, avoid all these things. So have safe sexual behavior, avoid multiple sexual partners, avoid high risk sexual partners, avoid early initiation of sexual activity, do not smoke, and obviously prevent and treat yourself from sexually transmitted diseases. If you are young, obviously for children, which we don't, take the cervical cancer vaccine. And if you're above 21, get the screening done through pap smear. So these are all the precautions one needs to take so that she doesn't develop cervical cancer.
Doctor, there is one more query from the audience. They are saying she is asking that after menopause, can we get cervical cancer?
Yes, yes, why not? There is no link to menopause or menstrual cycles towards cervical cancer, right? So cervical cancer is it's a cancer which develops in that organ. So there is no relation to menopause.
So, doctor, like what treatments do you recommend? Like what are the options for cervical cancer? Treatment options?
Broadly, if you are in a very early stage, like stage 1A, 1B, we say surgery should be fine. And after surgery, in that surgery, they remove the uterus. We'll keep it very simple. And some lymph nodes if required. After surgery, some people may require radiation, some people will not. Very simple. So surgery is for very early stage, like stage 1A, 1B. You remove the uterus. Some people may require chemoradiation after surgery. Stage 4 is the other end. They have spread the disease has spread everywhere. The only option is chemotherapy or targeted therapy or immunotherapy. The aim is control the disease and prolong life, which is called palliation. It is not for cure. That is the other end of the spectrum. So one end we are talking about surgery to cure very early stage. Another end we are talking chemoimmunotherapy to prolong life, not for cure. The middle locally advanced, you treat with chemotherapy and radiation both. Radiation is given over 5-6 weeks. Chemotherapy is given weekly for 6 weeks. Chemotherapy increases the effect of radiation called radiosensitizing chemotherapy. This helps to control the disease and cure you. Now, if you're very early stage, your survival is close to 90% or 80%. If you are locally advanced, your survival is between 50 to 70%. 5 year survival. Advanced disease, 5 year survival is close to 20%. In that, there are two things. The commonest cervical cancer is squamous cancer. 75% of women have squamous. 25% have adenocarcinoma.
Oh.
What we commonly see is adenocarcinoma behaves aggressively compared to squamous. So, what are all your bad factors? Advanced stage, adenocarcinoma. These are all your bad factors for prognosis. What are your good factors? Very early stage and squamous cell carcinoma.
So, doctor, like you have told, if the in the early stage uterus removal is the one of the treatment option recommended, then what about the girls who are like in the early age, they are not yet mothers, or for them?
That's a big challenge, right? So generally, we are lucky that we don't see cervical cancer that young.
Oh.
Most of them complete families. Number one. Unfortunate, the other side is also we don't see women with cervical cancer with early stage disease as common as stage 2 or stage 3. So now your question is, if you remove the uterus, young girls, where they will go? So to remove uterus means you should have early stage.
Yes.
So we don't see that many girls with early stage. And one good thing is we don't see cervical cancer that early. Most of them complete their families. But if you're a young girl and you get cervical cancer, which is a very, very early stage, then there is an issue. What you can then think of is alternative is chemoradiation to preserve the uterus. You can give radiation, you can give chemotherapy, definitely. But the dictum or bottom line is, suppose a woman who has completed her family has an early stage disease, remove the uterus. There is nothing more important than your life. If you have completed your family, even if you have one kid, what I would counsel my patient is, see, you have one kid at least. Now, just to have another kid tomorrow, we cannot put your life at risk when you have early stage disease, which many women don't present with. Many women unfortunately come in advanced stage or locally advanced. You are lucky you have early stage disease. So even if you have one child, that's why I would counsel my patient. I'm not saying I'm right or somebody is wrong, but you have to take a balanced approach.
So just out of the box, is it like if the woman has ended up with a cancer of third intermediate stage, like not an early stage, but it has the cancer has already been, can the ovaries be preserved
Yeah,
so
there is
that,
no problem with the ovaries here.
okay, so the ovaries can be preserved
That's
for
right.
the future
That's
if
right.
they
That's
desire
right.
to have a babies? So many technologies, so many new thing has entered into this cervical cancer. Oh my God. In fact, doctor, I should be also be punished, I should say, because I haven't taken any vaccination for cervical cancer yet.
No, people do not know, unfortunately. The awareness is not that there. And what we should understand again is through this forum, what I would like to emphasize is we have a disease which is preventable. We have a disease for which screening is there. We have a disease for which a vaccine is there. And it is the number two disease in women. So it's our duty to reduce the burden of disease, vaccinate, screen, educate, avoid high risk behavior. And then we have almost beaten because 99.7% of cervical cancer is caused by the HPV virus.
Yes.
So when you know who your troublemaker is, remove him from the way.
Yes, sir.
Very simple. Now you ask me about pancreatic cancer, stomach cancer, gallbladder cancer. 95% of the times you don't have an answer why it has come, what to do, how to prevent. Here you know. Despite knowing, if you are not doing, then that is not ignorance. That is actually foolishness.
Then I will accept, doctor. It's a kind of a my foolishness, then I will say. But yes, doctor, like any age is there that I should go for a vaccination, or any age we can go and have the vaccination?
Vaccination, as we discussed last time, around 12, 13 years is the ideal age to get vaccinated. But any woman, any girl, boy between the ages of 9 to 22 can get themselves vaccinated if they are not sexually exposed. 9 to
Okay.
22 is what the manufacturers recommend to be 22, some manufacturers up to 26 also. But the sexual exposure should not be there. And those above 15 years will need an extra shot of vaccine because their immunity response is less, or immune response is less.
Okay. So, doctor, this was something a very exciting information which we tend to spread it to our audience and everybody to spread the awareness of cervical cancer.
Yeah.
So, by this, doctor, we
If we have time, I would just address a couple of things.
yeah, sure.
So now, from a patient point of view, once you have finished treatment, you're going to have a few issues. Like what patients say is they have a poor sense of self-esteem or poor quality of life, or they may have pelvic pain even after radiation. So they may have burning in the urine. They may have some diarrhea kind of symptoms. These are all common post-radiation. So don't worry about it. They will improve over a period of time. Is there any diet linked to cervical cancer? No. So eat good homely food, take lots of vegetables, fruits, fruit juices, drink lots of water. This is what we say. So there is no food linkage. So for patients who are on treatment or completed treatment, no, have a balanced diet, no restrictions with food. Uh, Post radiation, you may have certain issues. They're all temporary. They will all get better. So don't worry. People also ask me how is some people do report problems in sexual function post treatment, which is understandable. And finally, people ask us, how is the follow up going to be? So the follow up for cervical cancer patients is like any other cancer patient. We call them every 3 months for the first 1 to 2 years, and after that, once every 6 months for the next 2 to 5 years, and after that, yearly. And in the follow up sessions, we just do a physical examination, and usually that is all that is required. And they are constantly uh, taught again and again or educated again and again regarding the risk factors and the need to avoid those risk factors. And though we tell them come after 3 months, come after 6 months, if there is any warning symptom like what we discussed, we tell them come immediately. So, from a patient perspective, this is what they should realize as part of their follow up, or which is also called as surveillance.
Oh. Doctor, there is a one query from the patient's audience. Sorry, I know it might be a repetition, but which is what is the most common part for cervical cancer?
Most common part.
Huh.
Hmm. So basically, the cervix is the part of the female reproductive organ. So in the cervix, you develop cervical cancer at something called a junction zone. We call it a junction zone. So in the cervix, there is a part called ectocervix, endocervix. At that junction, these cells start becoming cancerous, and then they start spreading.
And doctor, there is one more question. I guess the half question you have already addressed it. Possible side effects for treatment for short term and long term.
So yeah, so radiation we discussed. You may have pelvic pain, you may have diarrhea, you may have burning in the urine, sexual dysfunction issues, quality of life issues, etc. With chemotherapy, when you're giving weekly, you may have nausea, you may have vomiting, you may have weakness, fall in your WBC counts. Sometimes your creatinine levels may go up. Long-term side effects, not really, except these local side effects. But chemo per se, I don't think you'll have long-term side effects. Very rarely, some people can have hearing loss, or diabetics can have some tingling and numbness in their legs or hands. That apart, treatments are generally safe. They are well tolerated. Patients do well. And the chemotherapies are not like other chemos where you're going to lose all hair and become bedridden. Neither the radiation is extremely toxic.
Doctor, there is one more query. Can a unknown cancer person can get pregnant? Unknown cancerous can get pregnant. Might be the cervical cancer is unknown and they get pregnant.
Yeah,
In that
yeah. You may harbor cancer, you may still be able to conceive. So they have no relation with each other.
Okay. So, but then the baby will be safe, or
No. That's another session. You want to keep another session next time because you will
then,
have
sir,
to discuss what stage of cancer the patient is having and what trimester that baby is. You are looking at the first 3 months of the baby when the baby's organs are developing. You are looking at the last 3 months or the middle 3 months, mid trimester or late trimester. So it's a very complicated scenario. Let's not go into that. But it's not a good scenario to have also.
in fact, sir, if there is any other session, I will put a message to that Rock World 2022 who has asked the question to be
It's a
kindly
good
attend the next
question
question.
if you want to fail somebody in the examination in medicine.
Oh, okay. So, doctor, this is something which we have came to an end to this exciting and informative session. Doctor, we thank you very much and we appreciate your engagement and hope that the knowledge what you have shared right now will help in raising the awareness and promoting better health outcome, doctor. Doctor, like before closing, would you like to add some closing lines to the management of cervical cancer session, doctor?
Yeah, so the management of cervical cancer, I would add that chemoradiation is the commonest treatment which we give because most patients present is the locally advanced stage. But I think a day should come when we don't see cervical cancer or we see only precancerous conditions or very early stage which can be managed with surgery. At least we should not see patients who have advanced cancer. It may be a utopian thought, but if you are able to catch patients very early, the number of patients who go to advanced stage are going to be very, very less. And that should be our aim. And our aim also should be to vaccinate as many boys and girls as possible and make screening a very regular feature that all women above 21 should get screened in some form or the other, even in the resource poor settings. Not that everybody lives in Hyderabad or Bangalore or Bombay. Even in the most rural areas, there are techniques available, which we discussed last time. So screening should be a part of protocol. We have to beat cervical cancer. There is no other way.
Yes, doctor. Tied the knot, beat cervical cancer,
Yeah.
doctor. Actually, it's very, as you rightly told, that why are we fighting with the known reason of cervical cancer? We already know the reason, still we are inviting it. Come
True.
when we know the reason, why can't we avoid it? That's a very strong message, doctor. So, thank you everyone for joining us today. So, the information is always stay healthy, stay informed, and always stay connected with Cancer Reach. So thank you, doctor. Thanks a lot. Thank
Thank
you,
you. Take
everyone.
care. Thank you so much.
Thank you, doctor.